I would like to add to that. We've all been talking about integrating care, and we've talked about the NHS, and we've talked about at-home social care. Nobody's mentioned social care for people in employment. I'm currently working and I get NHS care from my GP on the hospital, etc. I get a support worker plus supplied by social services to get me dressed in the morning, take me shopping, etc. Then I have to go to a third government agency and get more money and go to a different care agency to get support to be able to actually do my job. Why are people who are in work or wanting to work that are disabled being treated differently to disabled people? Again, that comes back to the point that Angus was making about where does the money come from, where does it go?
Shall I have a go on that one?
I mean, I think the answer here is the things that Liz Kendall has been talking about with Andy Burnham. And Andy Burnham was talking about integrated social health and care long before Jeremy Hunt stood up in his conference speech. I think one approach here, which can be a very good one, is to give a personal budget to disabled people, whether they're in work or not, and then they choose how to deploy that funding for the various kinds of support that is available. And if you can do it then from one source rather than the three that you described, then that seems to me you're saving quite a lot of administrative costs in doing that and enabling the money to go further in providing care than it is at the moment. I mean, I'm not sure about the Better Care Fund. That's something that I'm not sure how that works. But I would hope very much that by improving resources in the way that I've described for the NHS, then we can ease some of the pressure elsewhere in the system and free up more resources for proper care.
So, if I'm to answer your question correctly, I think what we need to do is really spend some time listening to disabled people about what they actually need rather than what politicians think they need, and make sure that the money is available to do that, and it's from a unified government service and not parcelled out to different private companies. I've seen what happens in hospitals where one company looks after the providing the food and the dispensing of pills, and a different company looks after dressing and washing, and then another company looks after another thing. I don't think that is a patient-centred approach. You need a person who understands that your individual needs. So, maybe you need your pills before dinner or after dinner. And if you've got all these different companies running these different aspects, that can't happen. And I think you can only provide that if you have a unified government service in the public hands managing this stuff. And I understand the need for efficiency in the service and the idea that markets can provide that efficiency. But what we've seen in practice is, with healthcare, it doesn't work, and it's affecting people's health and their satisfaction with the service. I've seen it in my own family with my mother-in-law, who is, she's not being treated as she needs to by these different companies, and I worry about her, and I don't want anyone else to have to struggle against that. And the Green Party believes in market systems in some areas of the economy, but in health, it's far too precious to leave to the markets. So I want there to be free, joined up social care everywhere. And I'm happy to be grilled about where we find the money for that, because it really is there.
That was the actual question.
Okay.
Are you going to be robbing Peter to pay Paul? Because none of the funding for disability benefits are ring-fenced.
Okay. So I think that if disabled people get the benefits that they need in order to survive, that are realistic and matched to what they actually have to pay for, then we should trust them to decide how to use those benefits. And if the right things are made available for free, then the choice is a lot easier. And what we would like to do is to actually, we've got a number of ways that we can both save money in the NHS and bring in new money, as well as local councils. So, and we could start by looking at the £120 billion that's lost through tax loopholes every year in this country. And the HMRC has its budget slashed for looking at these loopholes. And as a result, people in small businesses like me get examined very carefully, but large corporations like HSBC, for example, are left to dodge as much tax as they like. And we need to address this. So the Green Party is being sensible about the amount of money we can get, like £30 billion back from tax loopholes.
Yeah, I think the question of ring-fence spending is a kind of macro issue here, which is that if you ring-fence NHS spending to an extent, then you say you're going to slash the welfare budget, then everyone's going to try and do their best to hurry into an NHS budget and sort of escape from the welfare cuts. It really makes it very clear that you can't really improve social care services to people in dire need if you don't deal with the institutional problems. And for example, the kind of personalised budget, the individual budgets idea. I think that's a great idea. It was a little bit of a gimmick. I mean, when my mother was very ill, there was a personalised budget, and they wrote very nice letters to her about your personalised budget enables you to do business, but it didn't really make any difference. It's quite difficult for an elderly person to make sophisticated budgetary decisions based on a 4-page letter that they've received. I mean, she just gives it to me and says, what do you make of all this stuff, kind of thing. So that seems to me to be rather gimmicky. But really, from a practical point of view, you can kind of make a kind of politician's sweeping promise, but unless you deal with the institutional problems and get decisions made close to the customers, so to speak, it's going to carry on with lots of overarching, wonderful sounding promises, but it's the individual citizens in need is where you judge the effectiveness of the system, not the beauty of the speech, if you see what I mean. One just quick thing to say is that we have a fully funded, our party is a fully funded programme of 8 billion extra investment. But I have to say part of that money is to support the mental health reforms which we've been outlining in the last 3 months and will continue to push for, which is the equal treatment of mental health services compared to physical health services. And it is a bit of a problem, especially if people have a combination of difficulties. They have physical disability, some cognitive problems or whatever it is, or even alcohol and drug-related issues. So, and also there's a big difficulty, again with this budget problem. If you're getting support when you're 17 years of age, when you get to 18, it sort of drops off the edge, and then well, who's my contact now? Parents suffer from this problem as well. So really insistent provided the funding to have equal treatment for mental and physical problems throughout the NHS, and to roll out a much more focused and patient-orientated approach with proper standards for mental health care. The extent to which the Better Care Fund is in practice, it's a temporary budget. It's not consolidated into a long-term plan, and so it needs to be put on a better statutory footing and needs to have a visible budget line which Parliament can vote for. At the moment, it's not.
Yeah, I mean, again, I know Stephen said that Andy Burnham and Labour Party were talking about this for a long time, begs the question again after 13 years in government, why was nothing done about it? You know, that if we talk about the Better Care Fund, you know, the 5.3 billion which came about in June 2013 was actually under this government of that.
It's not new money though.
Well, the money that was allotted and what the purpose of it for was much more streamlined. The initiative and the direction was much clearer. But the impact was so that both, you know, the NHS and the local government, because don't forget a lot of the costings, the costs that are paid are not always, you know, national government. A lot of it is local authority, local government. The idea was to kind of join them up together, and what we're hoping, again, and I keep kind of trying to reiterate that, is that with our pledge of putting that money back into the NHS, we pledge to keep what's already in place, to try and make that, you know, sharpen that up and make it more efficient. So, you know, we're not kind of having these problems. But, you know, again, and also, you know, I often hear this idea, you know, the nasty Tories are privatising the NHS. But let me just ask you this. A couple of years ago, it was taking a bit longer than it should have done in the NHS to supply wheelchairs for disabled children. So the option was, you either let those kids stay in hospital or have to arrange for their parents to get, you know, make certain arrangements around that, or you bring in another company, in which case it was WizKids. WizKids were brought in and they sped up the thing, and, you know, they got the wheelchairs out for the young kids, and they were off and on their way. Again, let's look at Specsavers, the nasty Tories. You know, we're privatising everything. The people that needed glasses that couldn't get them in time, you know, what we did is we called in a company to make sure that demands were met. Those people got their glasses and went on. So I know you often hear, you know, the scaremongering, you know, that we are, you know, we're not the party of the NHS, and we're not, you know, we're going to privatise it and do this. The party of the NHS is the one that has ring-fenced £12.9 billion. The party of the NHS is the one that increases the number of doctors and nurses. And the party of the NHS, to me, is one that pledges enough money, according to an independent report, to make it work. Not, you know, mislead people on £2.5 billion of a mansion tax, which leaves a massive £5.5 billion black hole. And people overlook that. And for me, that's what the reality is.